Plus, a new breakthrough in treating eating disorders. We're going to meet this doctor behind the new program. 7:19 is your time right now. Still much more to come here on the show. Up next, tapping into the brain to treat eating disorders. We're going to meet the doctor behind this incredible new treatment. A different type of technology is helping to now diagnose and treat, or at least pick out the better medication that will work better on a patient who is suffering from an eating disorder. It was created by our next guest, Dr. James Greenblatt. Thanks for joining us this morning, Dr. Greenblatt.
Good to be here. Thank you.
Let's first talk about the problem of eating disorders, and it covers a whole ram from bulimia to anorexia, but it is, there's some startling facts about how devastating this is.
Eating disorders are increasing, and the tragedy is these are life-threatening illnesses. People don't always know that eating disorders have the highest mortality rate than any other psychiatric illness.
Wow. And of those mortality rates, how are most people dying because of the shutdown in their systems because they have no nutrients? What's the main cause?
The tragedy is suicide is the leading cause of death, certainly for anorexia nervosa, and then heart disease and all the other complications of malnutrition.
And that's why years ago you started looking into ways to better use the medication, because right now there's many different kinds of medications that are used for a patient, and you've told me how doctors sometimes have a hard time of figuring out which ones will work best on a patient.
Yes, for over 50 years we've been looking at different medications to treat anorexia, and there's not one that's been found to be helpful. There's no FDA-approved medication. So doctors are struggling, and they just guess. These are educated guesses, and patients are taking 3, 5 different medications. So now we have a tool to kind of hone down which medicine might be effective.
We're looking at some video of how this tool is now being used. Talk about what this tool is, and it has to do with the brain scans.
Basically, we're looking at an EEG, a technology that we've had for many years to diagnose seizure disorders. And looking at an EEG pattern, we've collected a database over 20 years, and that database helps us predict which medicines are effective and which medications might not be effective.
So by wearing one of these types of helmets or headpieces, I guess you could call it, and then doing the brain scan, you're able to say which kind of medication is going to work best on treating a patient? Yeah,
we take that's how an EEG is set up. It's very simple. It's safe. You don't feel anything. You're lying about 20 minutes in a chair, and we get an EEG, and that's put into a database. And that database helps us compare the brainwave patterns with other patients that did well or not well with certain medications.
Where is this being used now, and how can folks here in the Valley find out more information about it if they're interested?
There are doctors all over the country that are using this technology now, and then there are doctors that are learning about it because it can be done in any EEG program, which is in every city in the country.
Okay. Answers to Anorexia, and also another book written by Dr. Greenblatt, The Breakthrough Depression Solution. We have all the information on azfamily.com if you'd like to learn more about how to better treat these eating disorders. Thank you so much for Dr. Greenblatt for joining us this morning. We appreciate it.
My pleasure. Thank you.
Stay with us, folks. We'll be right back.